Reading from Chapter 4, pages 110 through 125 in our abridged text. Weight Training Exercises. A general book on fitness and wellness cannot include a detailed description of all weight training exercises. The following pages present a basic program for developing muscular strength and endurance for general fitness using body weight, no equipment, free weights, and weight machines. Photographs and a list of the muscles being trained accompany instructions for each exercise. Labs 4.2 and 4.3 will help you assess your current level of muscular endurance and design your own weight training program. If you want to develop strength for a particular activity, your program should include exercises for general fitness, exercises for the muscle groups most important for the activity, and exercises for muscle groups most often injured. Regardless of the goals of your program or the type of equipment you use, your program should be structured so that you can obtain maximum benefits without risking injury. Please refer to the exercises in the textbook to learn proper weight training technique. Photographs and a list of the muscles being trained accompany instructions for each exercise. Common questions answered. Will I gain weight if I do resistance exercises? Your weight probably will not change significantly as a result of a general fitness program. One set of 8 to 12 repetitions of 8 to 10 exercises performed on at least 2 non-consecutive days per week. You will lose body fat, but also increase muscle mass, so your weight will stay about the same. You may notice a change in how your clothes fit, however, because muscle is denser than fat. Increased muscle mass will help you control body fat. Muscle increases your metabolism, which means you burn more calories every day. If you combine resistance exercises with endurance exercises, you will be on your way to developing a healthier body composition. Concentrate on fat loss rather than weight loss. Do I need more protein in my diet when I train with weights? No. Although there is some evidence that power athletes involved in heavy training have a higher than normal protein requirement, there is no reason for most people to consume extra protein. Most Americans take in more protein than they need, so even if there is an increased protein need during heavy training, it is probably supplied by the average diet. Consuming a protein-rich snack before or after training may promote muscle hypertrophy. What causes muscle soreness the day or two following a weight training workout? The muscle pain you feel a day or two after heavy weight training workout is caused by injury to the muscle fibers and surrounding connective tissue. Contrary to popular belief, delayed onset muscle soreness is not caused by lactic acid buildup. Scientists believe that injury to muscle fibers causes inflammation, which in turn causes the release of chemicals that break down part of the muscle tissue and cause pain. After a bout of intense exercise that causes muscle injury and delayed onset muscle soreness, the muscles produce protective proteins that prevent soreness during future workouts. If you don't work out regularly, you lose these protective proteins and become susceptible to soreness again. Will strength training improve my sports performance? Strength developed in the weight room does not automatically increase your power in sports such as skiing, tennis, or cycling. Hitting a forehand in tennis and making a turn on skis are precise skills that require coordination between your nervous system and muscles. For For skilled people, movements become reflex. You don't think about them when you do them. Increasing strength can disturb this coordination. Only by simultaneously practicing a sport and improving fitness can you expect to become more powerful in the skill. Practice helps you integrate your new strength with your skills, which makes you more powerful. Consequently, you can hit the ball harder in tennis or make more forceful turns on the ski slopes. Will I improve faster if I train every day? No, your muscles need time to recover between training sessions. Doing resistance exercises every day will cause you to become overtrained, which will increase your chance of injury and impede your progress. If your strength training program reaches a plateau, try one of these strategies. Vary the number of sets. If you have been performing one set of each exercise, add sets. Train less frequently. If you are currently training the same muscle groups 3 or more times per week, you may not be allowing your muscles to fully recover from intense workouts. Change exercises. Using different exercises for the same muscle group may stimulate further strength development. Vary the load and number of repetitions. Try increasing or decreasing the loads you are using and changing the number of repetitions accordingly. If you are training alone, find a motivated training partner. A partner can encourage you and assist you with difficult lifts, forcing you to work harder. If I stop training, will my muscle turn to fat? No, fat and muscle are two different kinds of tissue, and one cannot turn into the other. Muscles that aren't used become smaller or atrophy, and body fat may increase if caloric intake exceeds calories burned. Although the result of inactivity may be smaller muscles and more fat, the change is caused by two separate processes. Should I wear a weight belt when I lift? Until recently, most experts advised people to wear weight belts. However, several studies have shown that weight belts do not prevent back injuries and may, in fact, increase the risk of injury by encouraging people to lift more weight than they are capable of lifting with good form. Although wearing a belt may allow you to lift more weight in some lifts, you may not get the full benefit of your program because use of a weight belt reduces the effectiveness of the workout on the muscles that help support your spine. Summary. Hypertrophy, or increased muscle fiber size, occurs when weight training causes the size and number of myofibrils to increase, thereby increasing total muscle size. Strength also increases through muscle learning. Most women do not develop large muscles from weight training. Improvements in muscle strength and endurance lead to enhanced physical performance, protection against injury, improved body composition, better self-image, improved muscle and bone health with aging, reduced risk of chronic disease, and decreased risk of premature death. Muscular strength can be assessed by determining the amount of weight that can be lifted in one repetition of an exercise. Muscular endurance can be assessed by determining the number of repetitions of a particular exercise that can be performed. Static or isometric exercises involve contraction without movement. They are most useful when a person is recovering from an injury or surgery or needs to overcome weak points in a range of motion. Dynamic or isotonic exercises involve contractions that results in movement. The two most common types are constant resistance, or free weights and body weight, and variable resistance, many weight machines. Free weights and weight machines have pluses and minuses for developing fitness, although machines tend to be safer. Lifting heavy weights for only a few repetitions helps develop strength. Lifting lighter weights for more repetitions helps develop muscular endurance. A strength training program for general fitness includes at least one set of 8 to 12 repetitions, enough to cause fatigue, of 8 to 10 exercises, along with warm-up and cool-down periods. The program should be carried out at least 2 non-consecutive days per week. Safety guidelines for strength training include using proper technique, using spotters and collars when necessary, and taking care of injuries. Supplements or drugs that are promoted as instant or quick cures usually don't work and are either dangerous, expensive, or both. That completes the reading for this module. Next, we will read about flexibility and low back health.